Okay, so hi to everybody who's joining us live right now. We're going to give everyone a few minutes to join, but we will be starting promptly at 12:32. In the meantime, please make sure to share this live stream to your feed. And just to go over some quick housekeeping, please plug any questions you might have into our Facebook comments, and we will get to them during our Q&A session. Okay, and it is 12:32, so we will start right now. Thank you to everybody for tuning in to our special Lunch and Learn event, which is called Investigating Human Trafficking in North Carolina. This event is held in collaboration with UNC's College of Arts and Sciences Public Policy Program. My name is Danny Watson-Getz, and my pronouns are she, her, and hers, and I'm the new Executive Director of WomenNC. I'm honored and excited to be here moderating this event today. So I'd like to start out really briefly by telling you about WomenNC. For those of you who may not know, WomenNC's mission is to empower the next generation to advance gender equality in North Carolina. Our vision is to create a world free of gender discrimination. WomenNC has been committed to researching and finding public policy solutions to issues around gender disparity since 2009. We're a 14-year-old organization that trains college and university students to rigorously investigate instances of gender disparity and inequality in North Carolina communities. After researching issues, students recommend public policy solutions that include advocacy strategies to improve the status quo. WomenNC works with faculty and undergraduate students in UNC Chapel Hill's Public Policy Capstone course to provide a bridge between academic policy analysis and real-world workplace policy analysis. Small teams of students work with WomenNC to produce actionable public policy research that focuses on gender issues of concern in the state. Meeting with WomenNC's staff, student teams develop a work plan, research relevant policy issues, collect relevant data, identify and analyze policy options, and produce reports that include specific recommendations for action. In these projects, students develop skills in teamwork, leadership, communication, professional etiquette, and time management. The capstone students' research will add to our organization's knowledge about this macro-level issue impacting the organization, future WomenNC scholars, and more broadly, gender researchers to investigate these concerns in specific North Carolina communities in the future. This project is an initial step towards gender equity that other researchers can build on. And I'm so excited that joining us today are 5 of UNC's Public Policy Capstone students who are sharing the culmination of their fall 2023 research that leads to policy solutions to improve the status quo. First, I'd like our panelists to introduce themselves, and then we'll dive into today's topic. So, Sophia, can you start us off with a 60-second interview of who you are and your role in this project?
Hi, everyone. My name is Sophia. I go by the pronouns she, her, hers. I am a current senior at UNC from Charlotte, North Carolina, studying public policy with minors in data science and medical anthropology. I am currently on the pre-law track with professional experience working in immigration law. I also currently work at the UNC Center of Technology Policy on campus, working as a research assistant studying data privacy legislation in the US. I am also a small business owner as I work as a traveling henna artist around the Carolinas. My adequate knowledge of public policy, and including my skills of political analysis and research design skills, have allowed me to be a large contributor to this capstone project. I am incredibly grateful to WomenNC to working alongside them for our research this semester. It has definitely expanded my knowledge of public policy as it pertains to gender equality, and I can't wait to share our research with you all today. Thank you, guys.
Fantastic. Thank you. Michelle?
Hi, everyone. I'm Michelle Bright. My pronouns are she, her, hers. I am from Wilmington, North Carolina, and I'm a current senior as well, studying public policy and political science with a minor in data science. I have been working on and off campus in violence prevention for a couple years now, with the violence prevention and advocacy services on campus as a peer educator and volunteering with the Orange County Rape Crisis Center on their helpline. I am also on the pre-law track, hopefully in health law, and am very excited to present our project to you guys. Thank you.
Great. Thank you. Grace?
Hi, everyone. My name is Grace Berry. I use she, her, hers pronouns, and I am obviously also a current senior. I am majoring in public policy with minors in history and social and economic justice. So for me, of particular interest is the intersection of public policy and social justice within the cosmetic and fashion industry. And really what I would like to do within public policy is contribute and add value to the promotion of economic inclusiveness, sustainability, and the utilization of cruelty-free practices. Beyond this, my experiences kind of lie within food justice and accessibility. And next semester, I'll go on to gain my master's in public policy. And so within our work, I've assumed the role of team liaison, which gave me the pleasure of communicating with our key stakeholders.
Great. Thank you so much. Elizabeth?
Hi, everyone. I'm Elizabeth. I'm also a senior at UNC. I'm double majoring in public policy and psychology, and I also have a minor in history. I am also on the pre-law track. I have hopes of becoming an international human rights lawyer, and I have some experience working with more civil law firms, both here in North Carolina as well as abroad in Dublin, Ireland. I have completed a lot of public policy courses through UNC, and that has given me the opportunity to complete various policy analyses and research projects. And so it's been really interesting to focus more on gender inequality and human trafficking this semester and just dive really deeply into a subject that I didn't have a lot of experience in before.
Thanks. Jordan?
Hi, everyone. My name is Jordan. I use the she, her, hers pronouns, and I'm also a senior at UNC. I'm from Greensboro, North Carolina. I'm majoring in public policy with double minors in philosophy, politics, economics, and conflict management. After graduation, I plan to teach English abroad for a year before pursuing a career in education policy, specifically in regards to gender and socioeconomic inequality within the American public education system. And I'm really honored to be able to work with WomenNC and use my passion for public policy, along with some past research surrounding the Me Too movement, along with its subsequent alterations to female behavior and reproductive laws, how this relates back to more vulnerable groups.
Fantastic. Thank you all for those great introductions. So now I'm going to step back and I'll let our capstone students take the lead on presenting their research. So Sophia, I will hand it off to you.
Thank you, Danny. Good afternoon, everyone. Thank you so much for coming today to listen to our Lunch and Learn conversation about the investigation of human trafficking in prevention education as it pertains to North Carolina. It has been a pleasure to work alongside WomenNC this semester, and we are ecstatic about the opportunity to share our research with you all today, and truly hope it enriches your current knowledge regarding human trafficking as it pertains to North Carolina. So without further ado, let's get started. So what exactly is human trafficking? That is an incredibly loaded question. Many of you probably have a rough understanding of human trafficking to likely be along the lines of the trading of individuals for forced labor purposes. Now, while this is correct, there's so much more to it. According to the U.S. Department of Justice, human trafficking can be defined as the subtle or overt physical or psychological coercion and exploitation of a person to provide labor or sexual demands. Human trafficking, also known as modern-day slavery, violates the basic principles of human rights, and it stands as the most prevalent form of victimization around the world, affecting more than 25 million people. Human trafficking is also an enormous money-making scheme, profiting nearly $150 billion annually. Now, because human trafficking exists as an incredibly hidden crime of nature, this number is likely much, much larger. So before we begin to delve into the bulk of our research in human trafficking in North Carolina, it is important to understand and recognize that human trafficking poses a large public health threat to our communities, as it harms our most vulnerable populations through forced labor, sexual exploitation, and other forms of abuse. Specifically, women and children are among our most vulnerable populations. So, while human trafficking is prominent in all corners of the world, it is especially prominent within our own state, North Carolina. The high prevalence of major highways and interstates, military populations, agricultural land, and much more contribute to North Carolina's stance as the 9th highest state within the U.S. for human trafficking. So what can we do about all of this? With research suggesting that students in grades K through 12 are among the highest risk populations for human trafficking, prevention education stands as an effective strategy to mitigate the numbers of human trafficking within our state. So because of this, we recommend that educational institutions take off with the opportunity of prevention education, not only to inform students, but also the public as well. So to describe prevention education more specifically, it can be understood as a comprehensive model that addresses the root causes of violence. Prevention education has emerged as a critical tool in the fight against human trafficking by raising awareness, educating communities, and empowering individuals with the knowledge and necessary skills to recognize trafficking instances within their community. Prevention education emphasizes safety, trustworthiness, collaboration, and choice through strategies that not only impact and target the individual, but the community and external factors as well. So now that you all have a very broad understanding of human trafficking and prevention education, we are finally ready to delve into the bulk of our research. So our research can generally be understood as having two major components. The first component addresses the causes and prevalence of human trafficking within North Carolina, while the second component of our project focuses on prevention education and how it can be effectively implemented within the state. So since human trafficking exists as a crime of an incredibly hidden nature, as said before, statistical estimations on the actual prevalence of human trafficking in North Carolina are unknown. So because of this, we used existing academic literature to identify the major risk factors of human trafficking. With this data, we then used census data from North Carolina to map these risk factors out, and using a GIS mapping techniques, we created a North Carolina risk index map of human trafficking. The second part of our research focuses on prevention education and how it can be implemented effectively within North Carolina. So in order to recommend the most effective policy solutions to WomenNC, we conducted a series of interviews with relevant stakeholders within the state regarding what is needed for an effective state-mandated prevention education model. With the information collected from these interviews, we then came up with several legislative recommendations to help develop a state-mandated model within North Carolina. And now I will pass it on to Jordan.
Thank you so much, Sophia. So now we're going to dive into the types of human trafficking. In order to effectively combat human trafficking, it's crucial to understand its different forms. And the two that we chose to focus on were sex trafficking and forced labor. Sex trafficking involves coercing individuals, mainly women and children, into commercial sexual exploitation. In the Charlotte area alone, 61% of cases were confirmed sex trafficking, with an additional 38% that were suspected cases of sex trafficking. Forced labor, on the other hand, occurs mostly in sectors such as agriculture, construction, and domestic servitude. Victims face coercion, physical abuse, harsh working conditions. They endure long hours with minimal pay and mistreatment as well. Differentiating between these forms is essential for effective prevention. Forced labor often involves debt bondage, trapping victims in exploitation cycles, and sex trafficking employs tactics like psychological coercion, physical violence, and debt servitude. So another necessary addition that must be understood is the behavior of traffickers. They exhibit various traits, use manipulative tactics, employ recruitment strategies to rope victims into their crimes. Traffickers often blend seamlessly into society, which complicates law enforcement's efforts to capture them. Manipulation is a central tactic used by traffickers, using psychological pressure, deceit, and threats to instill fear and dependency in victims. This, to no fault of the victim ever, can create perverse bonds between the two, the trafficker and the trafficked, which complicates law enforcement's identification efforts. Traffickers also use diverse recruitment strategies, exploiting vulnerabilities, such as like deceptive job offers, fraudulent marriages, and then even further than that, they will continue to hold that recruitment over victims with abduction, blackmail, and threats. And finally, human trafficking relies on systemic subjugation, using abuse, isolation, and financial control to maintain power over victims. Financial entrapment is one of the largest issues that reinforces victims' dependence. So as stated earlier, human trafficking is not easily identifiable by law enforcement. Traffickers benefit from extensive transportation networks, especially using highways. And along the highways, like areas like truck stops, rest areas, and motels along the routes are common places for exploitation, which emphasizes the need for awareness among transportation professionals. Involving commercial driver licensing authorities in combating trafficking through education and training can heighten awareness. Truck drivers are often unknowingly witnesses to human trafficking activities, and they can play a pivotal role in identifying and reporting suspicious situations. So, although this is how it's commonly seen, human trafficking is not confined to the shadows of society. It very much happens in everyday activities. The military and agricultural sectors are two that are very connected to trafficking. Within the military, there's a hierarchical nature between recruits and pre-established members that can create an environment of abuse that cycles them into deceptive labor. In agriculture, on the other hand, vulnerable immigrants oftentimes endure forced labor under exploitative conditions due to false promises. Addressing human trafficking requires a comprehensive approach, understanding its forms, grasping traffickers' characteristics, deconstructing recruitment tactics, and addressing sector-specific challenges. Ultimately, combating human trafficking will require collaboration, comprehensive approach, and a commitment to justice with understanding and awareness of the survivors at the center of all efforts.
Thank you, Michelle. So a very critical part of understanding human trafficking and the intricacies of how it operates within our community, it's important to know that certain populations are more susceptible than others to human trafficking. As we have stated before, women and children are among our most vulnerable populations. In fact, in 2023 alone, in Mecklenburg County, the average age of human trafficked victims was about 14 and a half years old, while 98% of these victims were minors. So while these indicators, women and children, are very prevalent among trafficked individuals, there are several other indicators of high-risk populations. These include minorities, undocumented immigrants, children in foster care, communities with high rates of violent crime, such as rape, poverty, as well as geographical indicators, as Jordan just stated, such as major highways and interstates, agricultural land, and proximity to military bases. So again, while these are not all of the risk factors of human trafficking, it is critical that we are aware of these in order to prevent instances of human trafficking. So using these identified risk factors, as stated before, we created a North Carolina risk index map for human trafficking. While the screenshot you guys see on the slide is only a brief visual of what we included in our risk index map. The index accounts for all of the variables we previously discussed, the geographic indicators such as major highways and interstates, military bases, transportation terminals such as airports, and much more. And basically maps them within North Carolina across North Carolina counties to try and gauge the risk of each county within North Carolina for human trafficking. So as you can see, counties shaded in darker blue have a higher risk of human trafficking, while those in lighter blue shades and white colors have a lower risk of human trafficking. So we can go into this later if time permits at the end of our presentation, but Charlotte and Fayetteville seem to be very prominent hubs of human trafficking. So yeah, I'll pass it on to Elizabeth.
Yeah, so next we will look into some of the effects of human trafficking on survivors, starting with the physical effects. So most survivors of human trafficking do experience ongoing physical effects, and the physical effects here are only a small portion of the physical effects experienced by survivors, but 80% of victims of human trafficking have reported at least one of the symptoms listed here, while 1 out of 3 victims reported at least 5 or more. So some of the most commonly affected physical effects include headaches, stomach pain, and back pain. And then specifically in terms of labor trafficking, dizziness, headaches, and exhaustion are the most common physical effects. And then in adolescents who experience human trafficking are actually more likely to experience long-lasting physical effects due to the inhumane living conditions that they are subjected to. And then overall, there's also an increased risk for unwanted pregnancies with sex trafficking, and this may lead to unsafe abortions or other physical complications. And then next, we'll touch on some of the mental effects that are experienced by survivors of human trafficking. These effects can be a result of the coercive control of traffickers that often lead to increased guilt or increased shame in the victims. And in addition, individuals with existing mental health issues may be at a higher risk for being trafficked overall. But some of the most common mental health effects include depression, which is often characterized by a persistent low mood, or anxiety, which is characterized by intense feelings of worry over everyday situations, as well as post-traumatic stress disorder. In fact, some providers diagnose victims with complex post-traumatic stress disorder as the trauma is often repetitive and cumulative, which contributes to the complexity experienced by survivors. And then in general, more intense levels of mental illnesses seen in victims are often due to higher levels of abuse before or during the trafficking event. And then specifically with adolescents, these effects are still seen, if not seen in worse levels in adolescents. The most prevalent mental health effects for these children include PTSD, as before, as well as affective mood disorders, which can include depression and bipolar disorder. And then this is just shown by when you compare adolescents with no trafficking event to adolescent survivors. These adolescent survivors of human trafficking often spend more time with mental health services overall in their life. And lastly, on the effects, we will discuss some economic impacts. These economic effects are often difficult to quantify because, as we've discussed previously, human trafficking is a very shadowed and hidden industry. But by estimation, human trafficking is around a $150 billion business worldwide, and the International Labor Organization has estimated that forced labor trafficking has generated $3.8 billion, and then commercial sex trafficking has generated upwards of $27.8 billion, and these stats are from 2005. And it has also been estimated that nearly $19.6 billion have been lost in earnings overall when looking at human trafficking. And then because human trafficking is a transnational business, The specific impact on the economy of the United States is hard to track and limited in scope, but it is clear that human trafficking harms both national and economic security. And then specifically for the individual impacts that survivors of human trafficking face, yeah, they often have increased economic consequences and often need financial support in order to rebuild their lives, as it is particularly difficult for survivors to obtain employment and housing, which can just perpetuate a cycle of economic hardship on survivors. And yeah, now I'll hand it off to Grace, to Michelle, I'm sorry.
Hi, everyone. So thus far, we've talked about what human trafficking is, its operations, its effects, and the communities at risk. So now we're going to look into how the government at the federal and state level are addressing these. So first, for the federal statutes, the first comprehensive law addressing the safety and protection of victims was the Trafficking Victims Protection Act of 2000. This was amended for the 9th time at the end of the 115th Congress, which concluded on January 3rd of 2019. And so the notable amendments of this law were encompassed in 3 bills: the Trafficking Victims Protection Act, the Abolish Human Trafficking Act, and the Frederick Douglass Trafficking Victims Prevention and Protection Act. So the last 2 of these 4 mainly concern the government agencies. And so they create and update the authorities in 3 main ways. The first being instituting strategic task forces that have to report directly to Congress annually. The second being enhancing the training of officers and officials. And then third, actively decreasing the government contribution or catalyzation to the demand for sex and labor trafficking. So, for example, implementing provisions to reduce funds and resources to officers who may frequent adult entertainment facilities. And then finally, the Trafficking Victims Protection Act increases aid for victims as well as government transparency. And so now looking at prevention education at a federal level, there are no federally mandated violence prevention education requirements. However, the Department of Education does have a website with comprehensive resources for anybody to access. And so they provide that to leave it up to the institution, the parents, the guardians, and anybody who may be able to educate themselves to then educate children. So now looking at North Carolina specifically, in addition to the federal statutes, North Carolina has these 5 acts. The first being the Safe Harbor Act, which increases aid for victims who are minors. The GS 115C mandates sex education in 7th grade and beyond. SL 245 mandates child abuse prevention education for school personnel. And then SL 158 further criminalizes buyer conduct. So essentially placing more of the blame on the buyer rather than the victim. So then recently in June of 2023, Senate Bill 626 was passed, which, adding on to SL 158, decriminalizes the victims. So any criminal behavior that they may engage in while being trafficked, so this may come in the form of prostitution or facilitating the kidnapping and trafficking of other individuals, they cannot be criminally charged for those behaviors. And then prevention education in North Carolina, again, there is not a state mandated program. However, they do have Senate Bill 199, which requires public and charter schools to train their school personnel in child sexual abuse and human trafficking. However, it is important to note that this is a 2-hour training done every 2 years for only permanent school personnel. So this includes principals and teachers. It does not include janitors, cafeteria staff, assistant or substitute teachers, or anybody else who has interaction with the students.
Thank you so much, Michelle, for setting up the comprehensive framework and context for our research. So now we're going to pivot a little bit and go into the nitty-gritty of our comprehensive research findings, which are in regard to prevention education. So we had the pleasure of conducting interviews with 6 key stakeholders on human trafficking in North Carolina related to prevention education efforts. And what we really decided to do was combine qualitative data gathered from our stakeholder interviews with existing academic literature to identify the effective policy recommendations for a state-mandated prevention education program in North Carolina. So our qualitative interviews and research findings provided us with 4 pillars of effective prevention education, as well as 4 major challenges of prevention education. So now we can move on to diving into a little bit deeper on these separate 4 pillars. So these pillars are trauma-informed, evidence-based practices, remaining inclusive, as well as ensuring a public health model approach. So we'll start off with trauma-informed. So youth and young adults at all levels of education, from early start preschool all the way through secondary education, are exposed and susceptible to emotional, verbal, and physical abuse. This violence may manifest in a tangible form. Both the home and school environment can perpetuate it. The principle of this approach is acknowledging the experience of trauma as something done to the individual. And this lens really catalyzes healthy healing strategies rather than trying to approach and fix what's considered an abnormality in the brain. Moving on to evidence-based practices. So evidence-based practices are defined as the conscientious, explicit, and judicious use of current best evidence in making decisions about the care of individuals. Examining the application of evidence-based services in education, particularly in teacher selection and lesson implementation, reveals the really profound implications for students' personal well-being, educational health, and future prosperity. In light of this, educational institutions must acknowledge the influential role teachers play in shaping students' lives and give careful consideration to the selection of teachers, especially for programs focused on prevention education. This involves aligning teacher selection processes with the principles of evidence-based education and recognizing the long-term impact of teacher quality on students' overall development. So now we'll move on to inclusivity. So to truly achieve an inclusive educational framework, sensitivity obviously becomes paramount, particularly when addressing issues closely aligned with vulnerabilities of disadvantaged groups and obviously the nature of human trafficking in general. Equitable access, tailored content, and pertinent modifications must extend across demographics, encompassing all age groups, genders, socioeconomic backgrounds, religious beliefs, as well as sexual orientations. The concept of equitable access must transcend beyond conventional boundaries and really explicitly encompass individuals with disabilities and those requiring resources that are not in English. Collaboration with stakeholders, active parental involvement, and guidance from community leaders emerges as invaluable components of the development of an inclusive prevention education program. So we will move on to the public health model approach. And this entails aligning strategies with public health initiatives to tackle an issue as pervasive as human trafficking. Human trafficking, which is likened to a communicable disease, really underscores the need for a public health model centered on education. It stresses the importance of raising awareness, providing information, and promoting proactive measures to mitigate risks. And really, to be comprehensive, this model has to adapt to changing population dynamics, economic development, and lifestyle trends through community-based strategies. And now we will transition to Michelle and the 4 challenges of prevention education.
Thank you, Grace. Okay, so with every ideal policy recommendation comes challenges. So we identified the 4 major obstacles to implementing a state-mandated prevention education program, and that would be the political climate, parents and guardians, reflectiveness of demographics, as well as funding. And so first, looking at the political climate, it is very well known that North Carolina, as well as the United States, is very politically polarized and increasingly polarized. And so with the political parties, the major difference. They differ greatly in the value of what the government and what parents should have jurisdiction over, specifically with education. And so North Carolina being a swing state and the ever-changing political environment, politicians tend to make intermediate policy changes rather than comprehensive reforms. And so this then catalyzes an underdeveloped political awareness of the correlations between a divided community and comprehensive reform of violence and an unsafe community. So as an example, and more specifically to our project, Senate Bill 49 was passed in this past August of 2023. It is also known as the Parents' Bill of Rights. So it does respect and recognize the FERPA and HIPAA regulations. So FERPA being that educational institutions are required to inform parents of their child's academic, physical, and mental well-being, as well as receive consent before engaging or giving anything to their child medically. However, it also gives parents authority to approve or more so disapprove of prevention education, as well as restricting the language in K through 4th grade. So this essentially removes a majority of prevention education in K through 4th grade, as well as limits its presence in 5th through 12th grade. Regardless of that, the state does and should have a responsibility to maintain a nonviolent and healthy society. And so as Sophia talked about earlier, with communities that are of higher risk to violence and human trafficking, an ideal prevention education program would be able to tailor their curriculum to that given community. So the counties in North Carolina vary greatly in their demographic characteristics. And so, for example, counties with a higher population of females or a higher population of minorities would be able to tailor their curriculum to the risks of that culture and community, to give them the tools to respond to the potential for violence. And so then with that, educators also have to understand and recognize that the students in their area or in their schools must be given those resources and language and knowledge to be able to respond to that risk. And then finally, current prevention education is done by non-governmental organizations. And so that is their primary concern and their primary charism, whereas governments have a wide range of responsibilities, and human trafficking is visibly not, it lacks priority status. And so it is competing with all of the other responsibilities for what are finite resources. And so educational institutions and inherently prevention education are continuously allocated unequal and minimal resources. However, through our research, we have found that prevention education is provenly effective in the fight against all types of violence, and specifically human trafficking, because it raises awareness, it educates our communities, and it empowers individuals with the language and knowledge necessary to recognize, prevent, and report instances of trafficking. While not yet federally mandated or state mandated, prevention education serves as a feasible and effective solution to defeating violence and human trafficking in our communities. Thank you.
Thank you all so much for sharing your research. It was really, really impactful and wonderful to hear about how in-depth you went into it, not wonderful for the topic. So just a reminder on housekeeping for the audience, if you have any questions that you'd like answered, please pose them in our Facebook Live chat. If there's time at the end, we will address them or answer them in the comments on our website event wrap-up. So for the question and answer section, I'm going to pose some initial questions to the panelists, and I'll pose a question to a specific panelist, but other panelists, please feel free to jump in if you have any additional thoughts. So I actually want to circle back to Sophia, and I want to circle back to the interactive risk index map. So I would love to hear more about that map and that your team created.
Yeah, so Michelle, you already got it. So as I stated, we identified several risk factors that are indicators of high-risk populations within North Carolina. So we then used census data to map several of these risk factors out. For example, undocumented immigrants, individuals not proficient in English, minors. We mapped these variables out within North Carolina and then created a risk index, which accounted for several of these risk factors. I will wait for Michelle to get the awesome. So yeah, if you want to click that ArcGIS link. Essentially, we used a program called ArcGIS, which if you guys are not familiar with GIS mapping, it's a coding software that allows you to geographically map specific factors for visualizations. So in these maps that Michelle is scrolling through, we mapped out several of these indicators individually. So for example, the map that Michelle is on right now is the North Carolina abuse map. If Michelle was to click around, hold on, Michelle, can you stop scrolling? Sorry. If she was to click around, for example, this is a map of individuals with high school diplomas or less. You can see that Gaston County, or this is the abuse rate map still, Gaston County has an abuse rate of 78, about 79 individuals per 1,000. So with each of these individual maps, you can see the prevalence of specific risk factors. While this was kind of an addition to our project, the main focus was the risk index map, which Michelle, if you want to scroll down to. These maps also map out geographical indicators. So Michelle, could you click on the key in the bottom left corner? Thank you so much. So as you can see, the red lines focus on major interstates and highways within North Carolina. Charlotte, as you all may know, is a very prominent hub for human trafficking. Charlotte has a lot of major interstates and highways. That yellow shape right there is an airport terminal, which is kind of an ease of way for traffickers to transport their victims. As I mentioned earlier, Fayetteville is also a prominent hotspot for human trafficking due to the proximity to military bases. So yeah, these geographic maps kind of just map out just those geographical indicators that we talked about. But if Michelle scrolls down a little bit, we'll get to the big thing, our risk index map. So this basically combines all of the risk factors that we studied. And if you click on Mecklenburg County, for example, it has a risk index score of 6. This accounts for airport terminals, major transportation and highways, agricultural land, children in poverty, children living in single parent households, minorities. So as stated before, there are a ton of risk factors and indicators of human trafficking. And while our map does not account for every single factor, we tried to include as much as possible. And our findings are pretty consistent with what can be found in academic literature, with Charlotte being a very prominent hotspot in Fayetteville as well. If you look towards like lighter shaded areas such as Asheville is not near any major military bases or transportation terminals. And so therefore their score might be a little bit less compared to other counties. So if anybody has any further questions about the risk index map, I would be happy to talk into further depth with it. But we think that this is a really helpful resource in estimating the prevalence of human trafficking across North Carolina, since there is an apparent lack of, I guess, statistical evidence to support that.
Thank you so much, Sophia. And this map will be available on our website as well. And if there are any additional follow-up questions about the map specifically, we are happy to address them at any time. So I want to move to Jordan next, and talk just specifically about this huge topic of human trafficking. Can you talk about your experience navigating research on a topic that is so complex and as human trafficking, and just overall how much you've worked into it?
Yeah, of course. So one of the biggest difficulties that our group faced in the beginning was how broad this topic can be. And it's hard when obviously all of us are extremely passionate about this project. We have different areas of, specific things that we're passionate about. So narrowing it down to just focus on North Carolina was important to us. And then focusing on just sex trafficking and just forced labor was also important to us. It was difficult to narrow it down, again, because there's so many aspects that can go into labor trafficking or sex trafficking. Like Sophia was saying, all of those details on the key of the map where it shows like airports, other major transportation hubs, that was an extremely eye-opening aspect of this project that has stuck with me the most. Just actually being able to physically see that on the map where these highlights are, and maybe it's something in the back of your mind people might think, but to see it and like really have to face that is an issue so close to where we are, that definitely pushed like the importance of this project to me mentally, and like my passion for it was definitely like expedited by how close to home this was and how shocking some of the statistics were.
Thank you so much for sharing that. I want to circle back to Grace. You spoke a little bit about the stakeholders and that you did interviews with those stakeholders. Can you talk about those kinds of questions that you asked the stakeholders within those qualitative interviews?
Yeah, absolutely. So this was what I was kind of most excited for when diving into our research, just because we had such a rich amount of resources and people that we could talk to and speak with. And we learned pretty quickly in our qualitative interviews really how complex the issue was and how obviously as undergraduate students, we're kind of tapping the surface with the topic of human trafficking, even in North Carolina. But it was still incredibly valuable to learn from these conversations. And I can share a couple of the questions that we asked. So one of the preliminary questions that we asked in our qualitative interviews was, what is the responsibility, if any, of the state in addressing human trafficking? What solutions, if any, to human trafficking would you recommend or do you have experience with? And then kind of moving down a little bit more to the prevention education specific aspect of our qualitative interviews, we asked, how effective do you think prevention education would be in regarding human trafficking specifically in North Carolina? And then we also asked what their thoughts were about it being mandated by the state in K-12 schools. And then finally, I'll just note a couple more. We asked what facilitating prevention education might look like, and then also what challenges the state might face in regard to implementing a mandated prevention education program. But that is kind of a general synopsis of what our qualitative interviews look like. Our conversations, I know each of us in the interviews, like they became very complex and we learned so much. And I'm incredibly grateful to all of our stakeholders for providing us with their expertise and knowledge on the topic. It was very invaluable to our research.
Great. Thank you so much. And that's a great segue to talk more about prevention education. So Michelle, why do you think prevention education is a good model to help combat human trafficking?
Yes, I can speak highly to that. I have worked, as I said at the beginning, I've worked in prevention education for almost 2 years now, and am a huge advocate of it. In the beginning, I can definitely say there's a lot of misunderstanding or just lack of knowledge to what really prevention education is and what it looks like, specifically at such a young age, mainly like K through 4th grade, but also how important it is. And I think my best example would be comparing it to a subject like math or chemistry and how different the education is in kindergarten when you're learning what your numbers are, what 1, 2, 3, 4, and 5 look like, and then versus 12th grade when you're applying it to calculus and Calc 2. And I think that needs to be the understood approach of prevention education, that there are going to be topics that obviously aren't talked about in K through 4th grade, but that safety at its bare minimum is something that is valuable, and giving children at such a young age who are at high risk for child abuse and for violence, giving them that language and that knowledge is powerful, and it becomes an intrinsic value. It's about instilling values in children that then just become intuitive, like 2 + 2 is 4. You don't have to think about that now that we're in college. And so looking at prevention education and safety that way, it becomes an intrinsic value for ourselves as well as our state and country.
Thank you so much for that. I want to continue the conversation about prevention education and pass it over to Elizabeth. What are some of the reasons that parents would not want their child to go through a course on prevention education for human trafficking?
Yeah, so I specifically discussed a lot about this in the interviews that I conducted, and it was kind of a twofold answer. So on one hand, you have the families that are more well off, that are at a lower risk for human trafficking, and that their children are, just at a lower risk for being trafficked. And the parents of those children don't feel as though it is necessary to expose their children to such violence and such like such complex information that they'll never have to interact with. While on the other hand, you have children who are at a higher risk for human trafficking that may not interact with their parents in a healthy way, and their parents may not be accessible to them in order to get permission to take prevention education courses. And so, you kind of have, like, on the one hand, where you have parents who don't want to expose their children to prevention education because it includes topics such as sex, and human trafficking in general is just such a especially in terms of sex trafficking, is such a heavy topic, and some parents just don't want their children to be exposed to that at a young age. And then on the other hand, you have parents who are largely absent from their child's lives, who their children need this prevention education more than maybe others do, but the parents aren't present enough in their lives to give permission to their students.
Thank you for that. Now, I want to move over just quickly to a call to action. So, what's something that you want the audience to know that they can do to help with human trafficking? I'll start with you, Sophia.
So being that I discussed a lot of the risk factors and indicators of human trafficking, I think it's incredibly important that everybody is aware of the prevalence of human trafficking in their area, specifically as it pertains to risk factors. So, for example, I'm from Charlotte, and I am aware of the major interstates highways there that make it easy for traffickers to transport their victims across borders. Additionally, the presence of Charlotte Douglas Airport, which is a major transportation terminal, military bases, such as if you're from Fayetteville, you might lie at a higher risk of being trafficked. Additionally, minorities lie at a higher risk of being trafficked. So if you yourself are a minority, then being aware of how that puts you at a higher risk of being trafficked, and also educating others of that knowledge that you might have gained today, or if you feel the need to do so. And I hope you do research more into several other indicators of human trafficking, in making sure that you are spreading this knowledge to other individuals. I think that it would definitely help mitigate the prevalence of human trafficking in North Carolina. Educating others directly applies to prevention education, which is a model that would definitely educate students of these risk factors. And I think it just makes people more aware of their surroundings, the environment that they live in, and how that can lead to increased risk of violence.
Great. Thank you so much for that. Passing it to Elizabeth, what about you for your call to action?
Yeah, I would just say that it's so important to educate yourself and educate your family on this topic. And we hope that, as Michelle was saying earlier, like, you start with the basics with your children of, like, what is a safe touch? And, like, recognizing that it is, like, human trafficking does affect all of us. And we need to do better in terms of being proactive against human trafficking as opposed to reactive in treating the victims.
Great. Thank you so much. I'm going to pass it over to Michelle for your call to action.
Yes, thank you. I agree with everything that Elizabeth said. I think it's huge to understand that violence catalyzes violence. And so it starts at a very basic level of just understanding, say, like in elementary school, a little comment here and there, that is violence, and that people respond to that, and that can be a traumatizing experience. And those are all risks in being more high risk for human trafficking. So I think that educating yourself on and petitioning for prevention education to be in schools, and recognizing that the Department of Education has a responsibility to educate our society and have it be nonviolent and healthy, all comes down to understanding that small acts of violence are what catalyze all of these larger acts.
Thank you so much for that. Jordan, I'm going to pass it over to you.
Yeah, I agree with everything that everyone has said so far. I think another important thing to highlight when thinking about why this is so important is that while everybody does think they won't be trafficked, I mean, everybody thinks that they will know that they can't fall victim to that. But an important thing that we need to think about is others in our community, because you can only be as safe as the most unsafe person in your community. So, you know, like example, if, like we said, like those major hubs, like airports, rest stops, if you see suspicious activity, you may not know that it's suspicious unless you have that preventative education already instilled in you from when you're a student. Otherwise, you may see it, you may not know. You're just going to think like, I'm not being trafficked, so it's not an issue. But again, it's also to look out for those in your community to create like herd safety.
Thank you so much for that. And I'm going to pass it to Grace.
Yeah, so that kind of piggybacks a little bit off of Jordan's response. I know throughout our presentation, we noted multiple times that students' grades K through 12 are among the highest risk populations. And so what I would say for my call to action is to educate yourself as well as those around you, but really specifically those working within the school system in any capacity. As we noted, all entities are part of trafficking and how it operates out of the school system. And also those related to the school community have the potential to really advocate for child victims of trafficking. And beyond this, I think also it's super important to remain updated on the nuanced federal and state statutes that serve to address human trafficking, as well as other surrounding topics that may touch or affect trafficking. I know throughout our qualitative interview and just qualitative interviews and our research in general, we kind of notice like truly it's so complex, and part of that and is because there's not a comprehensive community understanding of what human trafficking is. And I know for me, when I approached this project, I have a completely different understanding of it now on the other side of this. And so I think just baseline educating yourself on really what's out there and what currently stands can be incredibly valuable in understanding the topic in general.
Thank you for that. And Sophia, I wanted to hand it over to you.
Yeah, I just wanted to add one more thing. I think we are all aware that human trafficking, as we've stated, it exists in all corners of the world. It affects, according to research, over 25 million people in the world, but I think we are all aware that this number is likely much larger. As Grace just said, myself, as well as I'm sure a lot of us also didn't realize that human trafficking exists in other forms outside of sexual exploitation. We talked about forced labor, which isn't as much of a recognized form of human trafficking, just to the ordinary person. So I think recognizing that human trafficking exists in multiple different forms is very important. And if a prevention education model was implemented, or not even state mandated, but programs are developed, that these programs lead with an understanding of the long-term consequences that victims go through, such as the ones that Elizabeth talked about earlier, and just making sure we are not placing blame on the victim, but the trafficker, because I think that's a huge issue today. A lot of these victims, this is their life, this is all they've known. And so making sure that when they are able to escape these scenarios, they are given the right knowledge and tools necessary in a community that understands what they went through, and give them the necessary support they need to rebuild a life outside of trafficking.
Thank you so much for that. And thank all of you for this really, really intense research. And you guys just did a really great job and definitely blew me away with how much you went into this. So now I'd like to wrap up the event. So I'd like to thank all of our panelists again and our viewers for joining us today. If you were not able to view the full event, it will be available on our Facebook page and our website, as well as our YouTube channel. You can visit our website later today to view the full event, as well as a list of resources and then our call to action notes. So thank you again to everyone for joining us today.